This morning, I would like to speak about prescription pill addiction. Why? Because over the last week or so, I've been seeing quite a number of people who are coming to see me because of prescription pill addiction. They have become dependent on sleeping pills, anti-anxiolytics, tranquilizers, uh, a whole lot of psychotropic drugs, and not only mood altering substances, not only psychiatric drugs can make you dependent, because dependence is not only a physical or chemical function. People can develop a psychological dependence where they become dependent on placebos. There are a tremendous amount of work and studies, research that has shown that placebos can have an equally effective, uh, have an effect on people similar to real drugs. So that now, from my experience and our experience with alcoholism and cocaine and all the other illicit drugs, we have seen one of the major reasons people use drugs is because it's available. It's a common sense thing. If you do not have it, you can't use it. And yes, alcoholics and drug addicts, prescription pill addicts, the body is not able to discriminate, which of these mood altering substances is legal or illegal. It's going to treat with them equally. It's good, whether the drug is prescribed by a doctor or you bought it in the rum shop or you bought it on the block, it it does the same thing. So that, there are basically three broad categories of psychotropic drugs. There are those drugs that are sedatives, that make you feel sleepy. And I'm saying this to say that not only the prescription medication will help you to sleep, the benzodiazepines and so on, but alcohol is also a sedative. There are a lot of other concoctions, cough syrup, that can also have a sedating effect. And you all would have seen that in the advertisements and so on. There are even painkillers that have a double effect. They can relieve pain and also induce sleep. There's sinus medication as well. And people are getting addicted to all of these because even antihistamines, people are becoming addicted to even painkillers, like the paracetamols and so on. And these, let me say this at this juncture. Anyone out there listening to this program, if you are going to put anything in your body, whether it be legal, illegal, whether it even be food, you need to check and see what are the side effects or the effects of this substance that you're putting in your body. So that, if you look at the side effects, I know in Trinidad, there's not much emphasis on side effects, but I know in the United States and other places in the developed world, they are mandated to tell you what the side effects are of each medication before they prescribe it or you buy it. And when you look at the list of side effects, after you listen to this program, Google any medication that you're having and look at the possible side effects of it. And when you look at the list of side effects, you'd wonder, why are we taking this in the first place? Because sometimes the side effects are much more dangerous, much more damaging, much more uncomfortable than the original condition for which you were prescribed. And I'm saying all of this to set the stage for the discussion that, to look at the whole question of prescription pill addiction. And I have researched some figures I want to share with you all. Prescription drug addiction is a growing concern both here in Trinidad and Tobago and globally. And it has significant public health implications. Now, I've been involved in this field. I know that, no comprehensive research has really been done in Trinidad and Tobago, indeed in the West Indies, because I used to be a resource person with the Caribbean Institute on Alcoholism and Drug Addiction. And there was always that complain, we don't have local data. We always had to cite American research and English research to describe a problem and then compare with what we are seeing here and extrapolate certain impressions. But with the few studies that have been done, there's one here in 2007 that was done by the World Health Organization, and it indicated that 13.6% of students in Trinidad and Tobago had used marijuana at some point in time, or hemp or cocaine at least once in their lifetime, with a higher prevalence among males, that was 17.5% among males, compared to 9.6% in females. So the men, of course, from empirical observation, we know young men have a little more liberty in this country. They are less restricted as the females. But I dare say that is changing now. When we look around in our society, girls have no difficulty sitting in a bar in open public and drinking now. And they believe, well, look, that's a statement they are making to the rest of us, that they have arrived and they have equal liberty. Alcohol consumption, of course, continue to be the most popular substance in secondary schools, and a research showed that there were 80%, 84% prevalence of students reporting that they had used alcohol in some form or the other, that is the high school population. I personally was involved in a research way back in the 1980s, and we looked at students in primary schools, and over 60% of the students in primary school had already tasted alcohol in some form. And that takes me to my own personal experience, because, I remember at age 7 or 8, I was given a drink of cherry brandy at the time for Christmas by my grandmother. And I know she was not doing this to create a problem. She just wanted to satisfy my curiosity. But I never forgot that experience. And that stayed with me for the rest of my life. Indeed, up to now, I remember that. But there's a lot of operational, data gaps when it comes to the control and use of drugs in Trinidad and Tobago. The absence of up-to-date statistics on substance use and misuse, particularly in Tobago, underscoring the need for improved data collection and monitoring. And let me say this from a personal experience. When I did my first degree in Jamaica in the 1980s, because of my own being a person in recovery, I chose to center my research on alcoholism in Jamaica as my thesis. And I came face to face with a difficulty that, a lot of people come to the hospitals because they were drunk and they fell and broke their arm, or they were drunk and driving and they got into an accident, or some drug-related medical problem. And they almost never got diagnosed for the problem of alcoholism. They were always diagnosed with a broken arm. So if you were looking for statistics as to how many alcoholics came to their hospital over the last year, you would probably think there are no alcoholics in Jamaica. And similarly in Trinidad, because the doctors and the medical profession, they treat with the presenting problem. So that even the statistics that I quoted, and let me just, in the United States, for instance, it is estimated that 16.3 million people misuse prescription drugs annually, with 22.6%, that is 3.7 million, misusing prescription drugs for the first time. So this morning, I really want to focus on prescription pills, but you can't separate it, as I said. The body does not discriminate whether the drug was prescribed, or whether you bought it under the counter, or you bought it in the rum shop, or you bought it on the block. And as I was saying, alcohol is a sedative, but then you have that other second group that are stimulants. And stimulants will include things like amphetamine, but also cocaine is a stimulant. Caffeine in coffee is a stimulant. All of these are stimulants and they do the same thing to the body. So, and then there's a third group that are hallucinogens that make you see and hear things that are not there. And that would include things like heroin and Hatur and PCP and all of those things. And of course, you notice up to now I have never mentioned marijuana because marijuana is the only drug, only drug that can do all three, depending on your what is called your mindset and the setting in which you're using it. So that I'm saying that to say that, you know, alcohol, which is only a sedative, is causing so much problems. And now we have so many people hooked on sleeping pills of all different kinds, anti-anxiolytics, antidepressants, and you name it. And then we have a cocaine epidemic still in this country. So that a drug that can do all three, how can we ever think that it is safe to the point where we have decided to decriminalize? And the society is interpreting decriminalization to mean it is okay now, you could smoke and you could, it's a free for all. So let's go to what are some of the commonly misused drugs, especially in the United States. It's opioids, central nervous system depressants like benzodiazepines, and stimulants are the most frequently abused prescription medications. And in terms of the youth, every day in the United States, it is estimated that 2,500 young people aged 12 to 17 will abuse a prescription pain reliever for the first time today. So that prescription drug abuse is prevalent in various regions, including Europe, Southern Africa, South Asia, indicating a widespread challenge beyond North America. Now, what I am actually seeing here in my practice is a lot of people are showing up now who are polydrug abusers. That is, they might have started with cigarettes, then went on to marijuana, alcohol included in conjunction with the cigarettes and the marijuana, and then move over to, because the same place that sells the marijuana sells the cocaine. And so they are quickly introduced, because the reason every drug user is using a drug, whether it be prescription or illegal, it is that they want to feel good and they want to feel good right now. They are using it either to help them to cope, to change their mood, or if they're depressed. And most of the time, after you've been using it a while, you become dependent on it so that you don't even have to have a social situation that is stressful, or don't even have to be facing some crisis that will cause you to want to use the drugs. Just because you used the drugs last night, when it is wearing away now, the withdrawal symptoms are so severe that you have no choice. You become willing to manipulate, to lie, to steal, to cheat, to do whatever you have to get, to sacrifice relationships and even put yourself at risk to get it. So I would want to expand on this. This is a two-part program this morning. We'll take a pause now and we'll come back in a few minutes and we will continue this discussion. So I don't want you to tune out. Of course, you can check in after the program. I'll be recording and posting it on YouTube and Facebook, so you can follow it there as well. So thank you, those of you who are listening, and see you in the other part 2 of the program.